Alrighty, so let's get started. Dr. Lamar, can you tell me a little bit about your background and what inspired you to pursue your career in medicine?
Yes, I'm actually from Florida. Grew up in Florida, and yeah, my initiation to medicine was a little different because I initially went to college to be. I was majoring in forestry, and it was actually when I did a rotation at a VA medical center, and I saw the interaction between the physicians and the veterans, and I said, oh, this is something interesting. And so, the more I kind of gravitated towards that in the rotation and talking with different physicians, it's kind of lit that fire in me to want to pursue this further.
From forestry to medicine, that's awesome.
I know it's a big jump.
Yeah, it's very unique, but that's awesome. And did anyone in specific inspire you?
I just really love watching all the different specialties and the interactions they're having with their patients and the different medical conditions that they presented with. And so it wasn't kind of like a mentor or anything like that for me, but it was just a lot of a period of a lot of observation, shadowing, kind of doing things on my own. And so that's ultimately what led to that drive and fire and passion really within me to pursue a career in medicine.
And what led you to neurology in specific?
Yeah, so that's always funny, cause I initially had my mind set on becoming a surgeon when I went to medical school, but when I did the neuroscience course in medical school, that really was it for me. So I was really kind of over the top with it, and so I would smile during the test, because it just made sense to me. So they were the most easiest test, the easiest test that I've ever done, and so I remember, having meetings with the neuroscience professor that, I just did, so I would always talk to him about neurology cases and that it really is neurology, at least at that time. A lot of my colleagues, it was kind of they kind of hated it, but I had like all these extra books and things like that, and so it really was just the course that it made sense to me. I fell in love with it and been doing it ever since.
That's awesome to hear. And do you think your identity as a Black individual has shaped your journey in any particular way?
It's a kind of complicated answer, but I think overall, just kind of with the journey that I have with myself, I think, and just my background, I think just being empathetic, always being a listening ear. And so I think going through some of the things that I've gone through, that's all I can say, that being more open and ready to be that listening ear to hear to someone's concerns, because a lot of times it's more than just this pill I can give you, just kind of understanding what they may be going through in life. And so I think being open and willing and just another ear for them to kind of lean in and gravitate towards is kind of, I think, one of the things from my experience that's helped shape my relationships with patients.
Absolutely. And I think empathetic care is very powerful, especially with connecting to your patients and with treatment outcomes. I think that's an awesome quality to have.
Yeah, I agree.
There is a statistic I'd like to share with you. So only 3% of neurologists in the entirety of the United States are Black. And Black people make up about 13% of the population. So to put that in perspective, that's 280 Black physicians versus 40 million Black patients. So how important do you think representation is in the medical field, and how does your identity strengthen you in that regard?
I think so. I think in particular, when you have patients of color and seeing me walk into the room, I think automatically a lot of times the guard has gone down. And many have told me that, where I might not be seeking that, but it's something that just kind of happens in the normal course of conversation. Because I think what allows me to kind of further that relationship with someone, in particular, minorities, is that, having a shared cultural kind of experience there as well. And so I think people have been more open than I think they normally would have, or more willing and able to accept what I'm telling them and kind of recommendations that I may give them. So I think that's kind of it's so beneficial to feel comfortable. Obviously, you want everyone to feel comfortable once they come into that physician office, which in itself is overwhelming to a lot of people. And so I think just having one more thing that kind of closes that gap, where people feel like they can relate to me, I can relate to them. I think that really helps with this is the overall general care of the patient there.
Absolutely. And that impact can definitely be seen with what you do. There's a study that came out that shows that when there are Black physicians in Black communities, those patients actually tend to live a lot longer and the mortality rate decreases. So definitely your presence is extremely important and the cultural competence and making sure there's someone who they can relate to and someone who actually understands their struggles for sure. And what advice would you give to young Black students who aspire to become physicians or work in healthcare in general?
I'll say the ultimate, because it can be intimidating just with all the all the kind of roadblocks I say that are kind of set place to maybe point you to a different road. But I would say, consistency, perseverance, all those things kind of play a role. That and it's one kind of valuable advice even in college. I remember when I first made the switch. It was a pathologist that was giving us a lecture, and she said not necessarily, she wasn't necessarily the smartest, but she always worked the hardest, and so she brought up uh, studying, on Friday nights and things like that, which is something I was already starting to do, but just kind of those other opportunities, where your colleagues may not be studying, to take those as goals, that you can go above and beyond, and that you can do it. You put your mind to it, you dedicate yourself. But it can be a difficult path at times, but it's so rewarding at the end of the day. That I'm so glad I made the decision, and so glad I had that experience in the VA medical center that pointed me in this direction. Because I'm not someone who grew up knowing I wanted to be a physician. I didn't even know what I wanted to be when I grew up. And so I was one who, started college with a one kind of major that was way out of the books and switched my major in junior year of college. So I think that door is always open if you're willing to kind of go through it. And so that's what I would say, just the work ethic, this ability to work hard, adapt, which is a lot in medicine that we have to do and not be so rigid. But I think it's certainly achievable for anyone who has a passion for it and is dedicated. And I do view it as a calling as well, because it is something that's so ingrained with, I think, within a lot of physicians that it's something we couldn't imagine ourselves doing anything else.
That's excellent advice. And so one final question for you. How do you celebrate Black History Month and why do you think it's important to keep celebrating it every year?
It's really just the joy of coming in to work with my family. My wife is a physician as well. And so just seeing the dedication in her kind of motivates me. So I think it's more of that as opposed to just saying it's one set thing that we do during Black History Month, but it's really kind of a lifestyle that we have throughout the year, So it's not, I don't think we kind of do anything extra than we do normally, We try to lift each other up, lift our community up, and being more involved in the community. So I think those things in general is what I would say.
I get what you mean. And do you have anything else you want to say?
Um, no, thank you for this opportunity. And yeah, I'll just emphasize, yeah, neurology is a complex field, and so one of my goals is just try to simplify it as much as I can to make it understandable, speak as much in the kind of normal everyday language, because it is really a different kind of universal language that we use a lot of times. And so I pride myself on try to simplify things as much as I can and always open to feedback where warranted, to how we can kind of make relationships better. And the ultimate goal is just to have patients feel better, feel comfortable, and improve their quality of life.
You're excellent, Dr. Lauren. Thank you so much for your time.
All right. Thank you.